Alive and Well is brought to you by Pine Rest Christian Mental Health Services.
This segment is sponsored by Pine Rest. September is National Suicide Prevention Awareness Month. Unfortunately, the suicide rate has been increasing over the past 2 decades. Experts have been looking into how we can better prevent suicide, and the answer is there is a lot we can do as a community. Today, Dr. Yvonne Edwards from Pine Rest Christian Mental Health Services joins us to talk more about their Zero Suicide Initiative. And it is good to see you, Dr. Edwards.
Thank you for having me.
Okay, so this Zero Suicide Initiative, I understand started back in 2018. Can you tell us what it is?
Yeah, so Zero Suicide was a platform or framework of various evidence-based interventions and practices that was started by Henry Ford's healthcare system about 20 years ago, actually. And what they found is that in organizations and communities that fully implement the model, they can see drastic reductions in suicide deaths, as much as 50 to 80%.
Wow, that's significant. So let's talk a little bit about what Pine Rest has been doing now and in the future to help reduce suicide.
Yeah, it's a multifaceted approach. And so some of the things that we've done is we've improved how we screen and assess for suicide risk, both of a comprehensive assessment that's the same across all our lines of services, departments, units, etc., but also regular screening. Some of our suicide risk assessment tools can be as predictive in predicting suicide deaths as blood pressure and cholesterol readings can be for heart attacks. And just like you would never want your doctor to miss that session where your blood pressure went up, we don't want to miss the session where somebody started having suicidal thoughts. So we'll be screening regularly for everyone.
Yeah.
We have also rolled out a collaborative safety planning model with robust safety plan collaboration between patients and clinicians, working together to figure out how to keep somebody safe during a suicidal crisis or mental health emergency. We are also shifting from an old style of addressing suicide risk, which looks at it as a symptom of other disorders such as depression, to one where it is a treatment focus in itself. And with that, we're training our clinicians in evidence-based treatments that are specific for reducing suicide risk.
You mentioned collaboration. Are you working with other healthcare providers in the area to kind of come together around this topic?
Absolutely. What we learned when you study people who died by suicide is that only about 30% of people who die by suicide ever had contact with a mental health clinician or mental health treatment, which is shockingly low and sort of concerning if you think about it. And so in order to address the issue of suicide deaths within our community, we need to partner across organizations. What we do know is that a lot of people who die by suicide had a recent visit within the last month often with a primary care physician or other medical provider. And so before the pandemic, we had a Zero Suicide Academy hosted at Pine Rest jointly by Spectrum Health and Pine Rest. And there were organizations from across our community that joined there, including Metro, Spectrum Health, Network 180, various organizations. And many of us have representatives that meet monthly in the Kent County Suicide Coalition meetings to figure out how we can collaborate better in screening, assessing, and getting people to treatment.
What have you seen happen with the local suicide rates during or because of the pandemic?
That was one of the big surprises of last year. Despite what I and many others predicted, suicide rates did not go up from the local data and nationwide data. In fact, they actually went down a little bit during the pandemic. I've never been happier to be wrong in my life, I think.
Yeah.
But there's concerns about an uptick after that. Part of what might have decreased suicide rates during the pandemic is having everybody in the same household again. We know that having kids at home or being back living with your parents can be a protective factor against suicide. And with all the changes that happened with the pandemic, that might have been a protective factor that might be leaving us as we roll into the new normal.
Well, folks, if you want more information about the many services being provided by Pine Rest, visit their website. It is pinerest.org. Dr. Edwards, thank you so much.
Thank you so much for having me.